Okay, first of all, please ignore the deer on the wall. Okay. So I have a patient named Randy, and he has ALS. And so, first of all, I will knock on the door, ask for permission to come in, introduce myself, and that would be Roxy McLean. I'm going to be your occupational therapist assistant student. Wash my hands. Ask the patient if he was in any pain. He stated that he was a 4 out of 10. And also asked him, how are you feeling on the board scale? 6 being like you're reading a book, and 20 like you just ran a marathon. He stated that he was a 12 out of 20. When I asked her how she was feeling, she stated that she was feeling a little tired and anxious, and her right arm has been cramping. I checked his vital signs were 124 over 73. Heart rate was 67 beats per minute. I would then explain to the patient what we're going to be doing for therapy today, and that was going to be working on his goal number 4, and that was bathing with MinAssist. He's currently at ModAssist. Asked if that's okay, and I'll take off his clothes, or ask if it was okay if I can take off his clothes and get him to help me as much as I can. Apply the gait belt, because we're going to be doing a transfer from the wheelchair to the shower chair, because he's at max assist with transfers. Place the wheelchair at a 40-degree angle, and that's like the shower's right here, wheelchair, 40-degree angle. Bend at my knees, grab the patient's gait belt, and instruct the patient not to grab onto my neck, but to just have the patient's arms on my, like around my shoulder blades, I guess, depending on how long his arms are. And instruct the patient not to grab your neck, place arm on her neck, block at his knees, block my knees with his knees, and count and rock 1, 2, 3, and lift, and then gently place him down on the shower chair. And then I would instruct the patients to move his legs, if he can, move his legs into the shower. Once I transferred him to the shower chair, I had to remind him to inhale through his nose and exhale through his mouth. And I instructed the patient to bathe while using a long-handled brush in a handheld shower. According to the FEM, patient was able to wash, rinse, and dry his chest, abdomen, right arm, left arm, perineal area, left upper leg, right upper leg, and only washed and rinsed both lower legs and feet. And I counted that as 75%, and that is MinAssist. And I know, being his first treatment, doing a bathing self-care activity, which is bathing, he probably wouldn't have just right off the bat got MinAssist, and so I would have to work up to MinAssist. And patient needed assistance with washing, rinsing, and drying his buttocks. Okay. And once he was done, I instructed the patient to move his legs out of the shower, scoot as far as he can, and he still has his, I guess I could have took the gait belt off while he was bathing, put the gait belt back on, and bend at my knees, grab onto the gait belt, tell the patient not to grab onto my neck, but to place his arms on my back, and 1, 2, 3, lift, and then transferred him back into his wheelchair. that was max assist, of course. And then he stated that he wanted to go back to bed, and so I moved ambulated his wheelchair to the bed, and once I did it at a 40-degree angle, and I dressed him. He said he wanted to get dressed, and did another max assist transfer with the patient, and I took the gait belt off once he was in his bed, and I checked his heart rate. It increased to 83 beats per minute while in the middle of the bathing activity, and then decreased back to 67 when transferred back to bed. Blood pressure increased to 130 over 80 after activity, and decreased back to 124 over 76 after the activity. And then once he was in the bed, I asked the patient how he was feeling, 6 being like he's reading a book and 20 like he just ran a marathon, and he stated that he was a 15 over 20. I said, okay. I asked if he had any questions, and I covered him up, put everything next to him that he wanted, like his call bell. Well, it wouldn't be his call bell, he's at home, but like his drinking remote and stuff like that next to him. Any questions, and then I would wash my hands and tell the patient that we would be back tomorrow to do another therapy session.